Hello again, everybody. Jonathan here. I am going to talk to you a little bit today about the package insert that often is included with the material that your clients might pick up at the pharmacy. By law, the FDA has manufacturers of pharmaceuticals include an extensive amount of information in the packages of medication that are sold to pharmacists, and summaries of that and sometimes complete copies of that full disclosure are distributed to clients now so that they have better informed consent as they take medications. Many of us may have never really looked at one of those package inserts, and I want to take a few minutes to make sure that you're well aware of the contents of those, the strengths, the benefits that that information has, as well as the downside, which is oftentimes people with relatively little medical training read these and are overwhelmed by them, assume that every single side effect that is mentioned as being hypothetically possible will in fact occur in their case, or that any of the cautions and warnings again indicate the kinds of problems that they would have were they to take a particular medication. So in a package insert, something like this is actually a very involved one. It's for a non-psychiatric medication, a relatively new form of treatment for controlling blood sugar. Because of that, the manufacturer has an enormous amount of information included because this is a, a new approach for physicians to take in helping manage blood sugar. But all package inserts have some things in common. First of all, they start with a section that's called indications, and that is a section that the FDA has approved, which tells the prescriber what kinds of health conditions this medication is considered by the government to be appropriate for treating. You may have heard the term off-label use, and that is a recognition of the fact that many times physicians do prescribe medications for purposes other than what are listed in the package insert. That's not an uncommon practice. In fact, that is the way that sometimes medications eventually become approved for additional uses. But your physician is very aware that it is a risky undertaking. Many doctors won't do it because were something to happen, even a side effect that is not a new event, they are potentially liable for damages. A lawyer could come and say, "Why were you prescribing that medication to my client when it's not an approved indication?" So oftentimes doctors will shy away from using something off-label, but on the other hand, many times they've tried other available medications, or it's just relatively recently been discovered that a medication is particularly helpful for some clients, some patients, and so they begin using it, and eventually, in a situation like that, the FDA catches up with reality and will approve the use. But that only happens after there have been controlled clinical trials comparing the medication against placebo and documenting that there is a statistically significant better outcome, and that the costs of taking the medication, not just financial, but in terms of side effects and unhappy outcomes, are low enough that it justifies considering that medicine for use in treating different conditions. So indications are what open the door to possible use of medication. So we're going to be dealing with medications that are indicated for treating mood disorders like depression, bipolar illness, psychotic conditions, schizophrenia, those sorts of conditions. Bipolar illness, we'll have mood stabilizers, we'll deal with anxiolytics, controlling anxiety, used to call those tranquilizers in the old days. We'll probably, in your studies, you'll be looking at hypnotics for sleep aid, um, maybe pain medication, a number of other categories of medicines. But every one of them, the package insert will spell out some indications. There will also be a second section, contraindications. And those are conditions in which only a fool will prescribe the medicine, or a last-ditch desperate effort to help somebody who is facing probably a fatal outcome except for extraordinary interventions. Really rare, most doctors would never consider prescribing a medicine that is contraindicated in their patient's condition. But those are things we want to be aware of. Sometimes they surprise you, they might surprise the patient. Doctors need to be aware of them, and usually are, of course. But sometimes you may be working with a client who has a particular condition that makes that medicine extraordinarily dangerous for that individual. After the contraindications, there's a section now called warnings and precautions. And that is sort of a lesser level of concern. It is not necessarily inappropriate to use a medicine where there's a warning or a precaution that applies to the client, but the doctor is going to be very careful about considering that medication for a patient that fits the profile about which the warning or precaution is indicated. In our field, for example, there would likely be a warning about the use of lithium carbonate, and a precaution that regular blood tests need to be conducted to monitor the blood level, because of the difference between a therapeutic level and a toxic level of lithium in a patient's circulatory system is really very narrow. And so that's a downside for the patient needing to go and have blood tests with some regularity. On the other hand, if the other mood stabilizers don't help keep a client from spinning out into manic episodes, the danger of risky behaviors in the manic phase might well be offset, more than offset the inconvenience and discomfort of regular blood tests. So warnings and precautions, and then there's also a section early on about how the medicine is made available. Is it in pill form? What are the strengths? Is it in an injectable form? Sometimes we have medicines available in several different forms, pill, oral, injectable, and so on. What are the strengths? What's the usual dosage, and so on? That's frequently, I think, or regularly actually announced prior to the warnings and precautions. Then there's always a section on side effects. There's sometimes a section on special populations. Are there things to be concerned about in pregnant women or nursing women or women who may become pregnant? What about the elderly or children? So your package insert is great, but the area that you can be the greatest service to your clients in is being really familiar with the side effect profile. And this sheet that I was waving up here, which obviously you can't read, has a tremendous amount of data on the frequency of side effects in clinical trials. That's unusual in a package insert. You always have data out in the ether sphere that could be tracked down, but it's important to understand that the fact that something is listed as a side effect, your clients want to know, or should want to know, that that does not mean it will happen to them. Anything that appears during clinical trials at a rate slightly more in the treated population than the placebo population must be listed in this, and to some extent even side effects that occur or have been shown to occur in closely related medications will also get a mention in that passage. So So help your clients to understand that this information is a very comprehensive description of what could happen, both good and not so good. It is not a prediction of what will happen. And so part of our job as therapists is helping them to notice both the positive response to medication and the undesirable responses to medication, and then to help the client to really be able to carefully evaluate the pros and cons of either trying the medication in the first place or continuing it uh, as, as they've begun to experience both a therapeutic response and maybe some side effects. One additional comment, just in passing, is that sometimes what we call side effects, well, they're a side effect because it's an effect other than the intended result of taking the medication. But we always think of them as negative outcomes. And in fact, oftentimes, what was originally considered to be an undesirable side effect turns out to be a new use for a medication. One instance that just comes to mind quickly is the medication minoxidil. It was developed as an antihypertensive to help lower blood pressure, and they noticed a tendency towards hirsutism and women developing unwanted hair, and eventually they realized that uh, topical application causes hair growth. And so it's now actually, I think, makes much more money for the company by being sold as a way to treat balding and rather than as an antihypertensive. So that's the story behind package inserts. That's part of our commission, is to really be more informed than the average member of the community about the likelihood of side effects. Uh, could those side effects be managed in some fashion so that the patient might be able to continue taking the medication if it in fact has a good positive therapeutic effect? So next time you pick up a prescription, look at the package insert, get familiar with what they contain, become comfortable with explaining some of the things. It's written for a physician, so the jargon is very esoteric, but still you will be able to help transfer the important information in that literature into your clients' awareness and help them know what to watch out for and know what to notice. Uh, all too often, because things don't result in rapid and complete resolution of a health issue, clients feel as if they are not getting any benefit, when in fact, um, for example, the sleep medication, if you used to waken 5 times a night, 6 nights a week, and now on the medication, you're averaging wakening twice a night, 3 nights a week, that's a real positive benefit. So help the clients to notice uh, progressive improvement. Okay, thanks for your attention, and I'll be talking to you soon. Hard to get it to turn off.